Fontanelles, commonly known as soft spots, are gaps between the bones of an infant's skull where the sutures intersect. These areas are crucial for the infant's development and birth process. The anterior fontanelle is the largest fontanelle and is located between the frontal and parietal bones. It is diamond-shaped and typically closes by 18 to 24 months of age. This fontanelle allows for significant brain growth and provides a window for assessing intracranial pressure and hydration status in infants. The posterior fontanelle is located between the parietal and occipital bones. This smaller triangular fontanelle generally closes within the first few months of life, usually by 2 to 3 months. Its early closure is facilitated by the rapid growth and fusion of these bones. The frontal suture divides the frontal bone into two halves, which eventually fuse to form a single frontal bone. The suture is a critical component during birth as it allows the skull to compress and pass through the birth canal. The sphenoidal fontanelle, found on the lateral aspect of the skull, is located at the junction of the frontal, parietal, sphenoid, and temporal bones. It usually closes by 6 months of age. The mastoid fontanelle is situated between the temporal, occipital, and parietal bones. It typically closes by the end of the first year. Fontanelles and the associated sutures provide the necessary flexibility for the infant's skull to deform slightly during passage through the birth canal, reducing the risk of injury to both the baby and mother. During the first year of life, the brain grows rapidly and the fontanelles allow the skull to expand in response to this growth. Fontanelles serve as important clinical indicators for pediatricians. For example, a sunken fontanelle may indicate dehydration, while a bulging fontanelle can be a sign of increased intracranial pressure.